Hi everyone! Welcome back again to this channel, and this is your pre-service teacher, Krisha Palalobrido. And for today's video, we are going to discuss the assessment of students with exceptional needs, specifically on the students with emotional and behavioral disorder. So if you want to learn something, please keep on watching!
So the exceptional learners in terms of education are individuals who require special education and accompanying assistance in order to receive or to reach their full potential as a human being. So when a disability is detected, information about the assessment is gathered. So the teachers are in charge of their making choices about special education eligibility. So the appropriate assessment accommodations are required once the special education services have been established and to guarantee that proof of their learning is collected in a fair and accurate manner. So when a student has been diagnosed with emotional and behavioral disorder, he or she consistently show one or more of the following traits in a way that it interferes with her or his learning. So first is poor academic performance, not due to the other disabilities. Second is poor interpersonal relationships. Third is inappropriate behaviors or feelings. Fourth is the extreme unhappiness, melancholy, or depression. And fifth is the unfounded physical symptoms of fears. So these are the two examples or the two case study about determining or diagnosing a student with behavioral or emotional disorders. So first one is Bobby is an 8th grade student who has exhibited emotional and or behavioral disorders characteristics since he was 4 years old. And once his mother noticed he has aggressive towards his younger sister as well as hurting animals, she had led him screened by the school district. So even though Bobby was placed in a risk preschool program, his behavior remained unchanged. So at this point, he saw the school counselor on a week basis. So during 2nd grade, Bobby was recommended for the special education program. But however, as an 8th grader, Bobby still challenges authority. He is defiant and disobedient. So Bobby continues to struggle in both his academics and in his social environment. So Bobby could benefit from multiple supports and strategies in the classroom for the improvement in his behavior, academic progress, as well as the attendance and socialization. So the second one is Andy, who is a 10-year-old boy and currently in the 3rd grade. So Andy was held back in kindergarten due to the immaturity and overall lack of readiness for the 1st grade. Andy struggled in 1st grade and the beginning of 2nd grade due to his inattentiveness and lack of organizational skills. So with the help of the tutor, however, Andy was able to make satisfactory grades. His 2nd grade teacher still believed there was more to his struggles in school and suggested to his parents that he has been to examined by his pediatrician for attention deficit hyperactivity disorder or the ADHD. So the doctor diagnosed Andy with ADHD and recommended that he receive medication. So his parents wanted to try alternative methods first. So the collaborative communication plan that was developed did not help Andy in school or at home. So since Andy was not making adequate progress, his 3rd grade teacher and his parents had a meeting to discuss other approaches that could benefit Andy. So the accommodation through a 504 plan were implemented and eventually Andy began receiving Ritalin. So Andy could also benefit from different strategies in the classroom to improve his academic progress, homework, written assignments, as well as his behavior.
Individuals with Disabilities Education Act or the IDEA guarantees students access to a free and appropriate public education or the FAPE in the least restrictive environment or the LRE possible. So as such, students diagnosed with emotional disorders are often included in general education classrooms. However, severe cases often require students to be taught in special education cluster units, self-contained programs, or even separate schools.
So as teachers, it might be difficult to teach children with emotional and behavioral disorders, but remember that encouraging and rewarding positive conduct is far more successful than striving to remove negative behavior. So the punishment and negative consequences tend to lead to power struggles, which only make the problem worse. And it is not easy to remain positive in the face of such emotionally trying behaviors, but don't give up. Your influence could mean a world of difference to the students who are struggling with an incredibly condition. So I hope that you learned something meaningful for today's video. And once again, I am your pre-service teacher, Krisha Paula Lobrido. And if you learned something, please leave a comment, like, share, and subscribe. Bye!